So here our question for today is, what do you think about biology? It's easy, it's hard, it's boring, it's interesting. So let's see what are the results. So till now we have one for interesting. So what do you think about biology? Boring, hard, easy, interesting. So till now we have one answer. Let's see the others. One only. Let's see the others. Waiting for your answers. Hard. Okay. Hard. Three, they said hard. Four, they said interesting. This is a competition between hard and interesting. So till now I have seven. So I need more answers. So we have four interesting and the three hard. Interesting is winning till now. So I have five and three. Who changed the answer? So I have five interesting and three hard. Easy? No one say easy, huh? It's not easy. Next lesson is going to be easy. So you'll change your mind. So uh, five they said interesting, three they said hard, and zero boring, zero easy. Okay, so let's start. Let's see with others. I need more. So I need more answers. So click on the link and only click on the link and answer the question. I'm going to send it more the chat so you can enter the new student that enters that now. They can click on the link and answer the question. What do you think about biology this year? It's interesting, it's hard, it's boring, it's easy. So I'm going to give you 1 minute more and then we can start our session. So till now we have five and three. Five interesting, four hard. We became equal. Five and four. So let's see the final result. Five interesting and three, four hard. Five, four. Interesting and somehow hard. Six and five. Okay. Six interesting, five hard. Good. So good. So this is all the results till now. Six interesting and five hard. At the end, maybe we'll find the results. So now we're going to move to our lesson part five, which is the last part of the nervous system. Nervous system part five. So in the nervous system part five. In part four, we identified that the ventral root has a motor function. The nervous system propagates from the dorsal to the spinal cord and from it to the brain, then to the concerned part. So the dorsal has a sensory function. We determined that the nervous muscle propagates in a centrifugal manner in the motor ventral root and in a centripetal manner in the sensory dorsal root. These are the notes in the part four last week. And also we identified that the spinal nerve has a mixed function. It has both sensory and motor function. What about the synapse? Synapse said that it's a functional connection unit between the neuron and the following cell, another neuron, gland cell, or a muscle cell. It doesn't mean only between a neuron and a neuron. Synapse, we have two synapses. For example, we have synapse. The synapse is found here between two neurons. For example, in this case, presynaptic before the synapse. After the synapse is called postsynaptic, and the middle is called synaptic cleft. So classification of synapses according to their structure and according to their function. According to their structure, we have neuronal synapse between a neuron and a neuron, neuromuscular synapse, which is called the motor and the plate, and neuroglandular between a neuron and a gland. These two, neuromuscular and neuroglandular, they are called neuroeffector. I'm moving faster because already we discovered this, but this is a quick revision. According to the structure, as I said, neuronal and neuroeffector, neuronal between neurons, a neuroeffector between a neuron and an effector organ. This effector organ, it can be a muscle or a gland. According to their function, we have two types of glands, excitatory or inhibitory. Excitatory, as its name indicates, it allows or permits the propagation of the nervous messages from the presynaptic to the postsynaptic cell, while The inhibitory, it inhibits the propagation of the nervous message from the pre to the postsynaptic cell. Propagation of the nervous message through a synapse. Maybe there's a convergence where they meet at the same neuron, or maybe it's a case of divergence where they diverse, where the nervous message or presynaptic neuron carries message to many postsynaptic cells. Drugs mode of action. This is our new ideas for today. Drugs mode of action. We have endogenous and exogenous. Endogenous chemical. Endogenous is a substance that's found or produced naturally inside my body, like hormones and other neurotransmitters. Whereas the exogenous, it's an artificial substance. It's a substance that is produced or provided by external sources from outside the body, like drugs and medicines and others. Agonistic drug and antagonistic drug. Agonistic drug, if the drug has the same function or effect of an endogenous neurotransmitter. So agonistic, it has the same function, or at least it enhances or it facilitates its effects. While antagonistic, like anti, is opposite, if the drug has the opposite function or the effect, or at least it inhibits or it blocks its function. So agonistic drug is the drug that has the same function or effect, or at least it facilitates or it permits or it enhances its function. Whereas antagonistic drug is the drug that has the opposite function or effect of an endogenous neurotransmitter. Or minimum, it inhibits or blocks its function. Drug, the word, it's not, for example, cocaine, heroin, and so on. Drugs, maybe it's a medicine. Okay? Analgesic and analgesic. Analgesic is the substance that can cause pain. Like we have a substance inside our body, it's called the P substance. This P substance is causing pain. It lets us to feel pain. While analgesic, like analgesia, for example, it reduces or relieves the feeling of pain, like morphine. Analgesic, يعني, for example, like bench. This is analgesic substance. Okay, so let's repeat. Agonistic drug is the drug that has the same function or effect, or at least it enhances or it facilitates or it allows the drug to function. Whereas antagonistic drug, it has the opposite function or the opposite effect, and at least it inhibits or blocks it. Whereas analgesic substance, analgesic, what does this mean? Is that it causes pain, like the P substance, while analgesic, it reduces or relieves the feeling of pain, like morphine, for example. Mode of action of amphetamine on dopamine synapses. Pay attention here. In normal cases, dopamine release in few amounts causes a feeling of limited feel of pleasure and hyperactivity, which ends after a short period of time. So dopamine release in few amount causes a feeling of pleasure, a high feeling of pleasure and hyperactivity for a short period of time. And this will end. While amphetamine, as well as most ecstasy drugs, facilitate or activate. So the exocytosis of dopamine. This exocytosis will play a role in controlling the body movement, increasing activity, and prolonging the feeling of pleasure. So you have a long feeling of pleasure. So amphetamine as well as most اكسس drugs الادويه اللي بيعمل هيك النشوه بيصير مبسوط وبتزهزه. This is called, this is the meaning of the hyper pleasure and so on. So amphetamine, it helps the dopamine. So in normal cases dopamine, they have a feeling of, they give a feeling of pleasure for a short period of time, whereas amphetamine, it activate or facilitate the exocytosis of dopamine, so they have a higher effect. So here amphetamine injection will enhance the dopamine exocytosis, and you have hyperactivity and pleasure feeling for a long period of time, while dopamine for alone, it will give a short time feeling of pleasure. So dopamine is an endogenous substance, whereas amphetamine is an exogenous substance. So both of them, they are agonistic. So they have the same function and they enhance So amphetamine enhances the function of dopamine and giving a higher and longer feeling of pleasure and hyperactivity. Mode of action of morphine. You know, some people they take morphine. This morphine is taken in case of high feeling of pain. Mostly people having cancer, they took this morphine because they have a high feeling of pain. So usually there are three neurons that interfere in the transmission of the pain message and in the pain sensation as well. First type of neuron is called the modulatory neuron. This is the modulatory neuron. What does it do? It secretes the substance which is called enkephalin. Okay, this substance is called enkephalin. It's called endorphin as a neurotransmitter. So it's enough to study that it's called enkephalin. The presynaptic neuron, this is the second neuron. So the first neuron is called the modulatory neuron that secretes enkephalin. The presynaptic neuron that secretes the substance that let us to feel pain, analgesic substance, the pre substance, and the postsynaptic neuron that has receptors for the P substance. So how many types of neurons do we have? Three. The modulatory neuron, it secretes enkephalin. The presynaptic secretes the P substance, and the postsynaptic neuron that has receptors for the P substance. Mode of action of morphine. In normal cases, enkephalin is released and binds to specific receptors on the presynaptic neuron. This binding will decrease the exocytosis of the P substance. So this will partially, pay attention to this word, will partially. So enkephalin will partially inhibit the pain message, will not inhibit it totally. Whereas morphine and enkephalin, they have highly similar spatial configuration, meaning that they have a highly similar shape. Thus, morphine will bind to the receptor of the enkephalin, and this binding will totally blocks. Here is the difference between enkephalin and morphine. Enkephalin, whenever it's released, it partially inhibits the exocytosis of the P substance, but it doesn't inhibit the total exocytosis of the P substance as shown in this figure. Whereas morphine and enkephalin, whenever morphine is released, will totally inhibit the exocytosis or totally blocks the exocytosis of the P substance. This will lead to the total inhibition of feeling of pain. So both of them, they have the same function, decreasing the pain message or decreasing the feeling of pain, but who has a higher effect? Morphine. That's why people have cancer and they use morphine as an analgesic substance. So they use it morphine and they don't use enkephalin and they don't depend on enkephalin. So you have complete inhibition of the exocytosis of the P substance in the case of morphine. So which one has a higher effect? Morphine. Okay? This is an endogenous substance enkephalin, while morphine is an exogenous substance. So both of them, they are agonistic. Mode of action of cocaine. Cocaine, you know this. You know cocaine. What is cocaine? Sure. So normal cases, we have dopamine is released, giving the feeling of pleasure that we talk about. So this feeling of pleasure is for a short period of time. And then dopamine, they are recaptured. They are reabsorbed back in the presynaptic neuron. So they are released in the synaptic cleft and they are reabsorbed back by the presynaptic neuron. So what will happen in the case of cocaine? Cocaine blocks the recapture of the dopamine. So blocking the recapture is not recaptured. It's not getting back to its normal position. So it prolongs the effects of dopamine. So high feeling of pleasure, prolonged feeling of pleasure, and you have higher feeling of pleasure for a long period of time. So here, cocaine, it inhibits or it blocks the recapture of dopamine. So here, dopamine is an endogenous, while cocaine is an exogenous. So both of them, they have the same function. They have feeling of pleasure, but cocaine has a higher effect. Don't use cocaine. So cocaine inhibits the reuptake of dopamine, producing effects such as increasing the heart rate and increasing the blood pressure. And some people, they die overdose. If you listen hear about this, so overdose, so they die overdose because higher increased heart rate and increase the blood pressure. How do you explain the action of cocaine? Cocaine, it binds to the channels of the presynaptic membrane and prevents the dopamine recapture. Action of dopamine persists as long as the dopamine is binding to its receptors. Cocaine acts as an agonist, sorry, to dopamine. They have the same function and they have the same effect. So cocaine acts on the presynaptic membrane. Okay, this one. Let's move now to the action of cocaine. In the presence of cocaine, what will happen? You have an action potential. CA2 plus penetrate the presynaptic terminal, release of dopamine, binding of dopamine to the postsynaptic receptors, no recapture of dopamine by the presynaptic neuron. And finally, we have feeling of pressure will persist. This is the action potential, reaches the presynaptic terminal, CO2 plus enter, and this CO2 plus will cause the release of dopamine, where cocaine, this one is cocaine, will inhibit the recapture of dopamine, and this will cause the dopamine to fix more period of time on the receptors, thus will create a long feeling of pleasure. Curer on ACH is called acetylcholine. Acetylcholine is an excitatory neurotransmitter. The symbol is ACH. Okay? Acetylcholine is an excitatory neurotransmitter found in the motor and the brain, and mainly in the skeletal muscles. Okay? Leading to the contractions of the muscles. Whereas curare, the curare is a substance that have a higher a spatial configuration similar to that of acetylcholine. So they are very similar to each other. So curare will bind to the receptors of the acetylcholine on the postsynaptic neuron, preventing the binding of acetylcholine. So curare will take the place of the acetylcholine. So will bind to the receptors of the acetylcholine. This will lead to the relaxation of the muscle and may lead to the paralysis. Acetylcholine is an endogenous substance, whereas curare is an exogenous. These two, they have opposite function. Acetylcholine causes the contraction of the muscle, whereas curare goes to the relaxation and even paralysis of the muscle. You have to know that nicotine will filter and activate the acetylcholine binding sites, producing effects such as increased heart rate and increased blood pressure. And this is why they say you don't have to smoke, since nicotine will bind to the receptors of the acetylcholine, activate these acetylcholine binding sites, producing effects such as increasing heart rate, increasing blood pressure, and this will have a high effect on your health. Okay, here we finish everything related to this session number 5.